to Integrated Spine, Pain, and Wellness. I am Nikki Goyle, and I am here with my husband, Dr. Ashu Goyle. And today we are going to be talking about arthritis. Arthritis is a form of chronic pain, and you see it pretty prevalent in our community of patients that are coming through the door. So we want to take a moment to talk to Dr. Goyle and kind of get some background on exactly what arthritis is, what the symptoms are, and how you can treat it so you can live a pain-free life. So Dr. Goyle, can you tell us a little bit about arthritis and, basically what it is and, some of the symptoms?
Sure. So arthritis by definition is inflammation of a joint.
Okay.
So there are two main types of arthritis. There's osteoarthritis, which essentially happens to everyone. That's normal wear and tear of your cartilage.
Okay.
So anywhere two bones comes together forms a joint. Between the joint, there's cartilage. That serves as a cushion between the joint space. Over time, due to gravity, activity, whatever, the cartilage can wear out. And then what happens is it creates an inflammatory state, which causes pain. That's osteoarthritis.
Okay.
Now, there's another type of arthritis called rheumatoid arthritis. Now, that is a completely separate condition. Rheumatoid arthritis involves your immune system actually attacking your joint. So that's what we call an autoimmune disorder.
Right.
So people with rheumatoid arthritis have an immune condition where their immune cells see their cartilage as a foreign object. So they'll attack the tissue and then create inflammation, which can lead to joint destruction and debilitating pain over time.
So what is the age range that you're usually finding patients who are experiencing osteoarthritis versus rheumatoid arthritis?
So rheumatoid arthritis, you can see it in juveniles. There's a juvenile rheumatoid arthritis. So it's an autoimmune disorder. So whenever it decides to manifest, if you have the genes for this autoimmune disorder, it can manifest in childhood and adolescence or in adulthood. So the spectrum is pretty wide as far as the age. As far as osteoarthritis, we typically see it, osteoarthritis in older patients, but you'll see it in younger people too. Athletes, for example, will develop osteoarthritis at a much younger age, and that's from the impact of whatever sport they're performing. It just causes a wear away of the cartilage. The mechanical stress on the cartilage causes it to degrade. And unfortunately, there's really no blood supply to that cartilage. So once you develop your joints fully and the cartilage is fully developed, as it deteriorates, you can't really do anything to replace it. So osteoarthritis can affect anyone from early 20s to older, 65 and older. But I have a few professional athletes I take care of, semi-professional athletes that have pretty advanced osteoarthritis of their knees and other joints. And they're young in their 30s. So
you've touched on it a little bit as far as rheumatoid arthritis versus osteoarthritis, but let's start with osteoarthritis. And if you could just give us some idea of what symptoms might look like. So for people that are watching this video, at home, if they're experiencing certain symptoms, this might kind of let them know, all right, I need to come in and see Dr. Goyle to, have him evaluate and see if this is something that's going on.
Sure. So osteoarthritis and rheumatoid arthritis can present the same way in terms of pain. One of the key differentiating factors is that osteoarthritis tends to be unilateral. So for example, it'll be one knee versus both knees. With rheumatoid arthritis, it attacks all your joint tissue.
Because your whole body's inflamed, basically.
Well, exactly. Well, the immune system recognizes any of that cartilage tissue as foreign, so it attacks it evenly throughout the body.
Got it.
Whereas rheumatoid or osteoarthritis specifically is wear and tear. So that's going to affect if you're right-handed or left-handed, whatever side your body is dominant, that tends to be the side where the arthritis develops. So, but usually people come to see me when they're having joint pain of any kind. So, and a lot of people are concerned that it might be rheumatoid arthritis, but we have these conversations where I explain the difference between rheumatoid and osteoarthritis. They can both be a challenge to treat. But typically, as far as pain presentation, people usually describe morning stiffness.
Oh,
So
okay.
when your joints are active and you're moving your body, you form synovial fluid. This is actually a lubricating fluid, hyaluronic acid, that's created in the joint that lubricates the joint and allows for smooth motion of your joints. When you're in bed sleeping all night, you're not moving your joints. They dry up, they become stiff, and in the morning, people will describe morning stiffness or worse pain in the morning, and as the day goes on, their pain actually
Gets better.
improves. Yeah.
Interesting.
So
And that's with osteoarthritis
and rheumatoid arthritis.
and rheumatoid. Okay. And then as far as when you come in and you do an exam and you are diagnosing somebody with osteo versus rheumatoid, is the rheumatoid arthritis diagnosed with a blood draw or a blood test?
It is, yeah. Usually a primary care physician or a rheumatologist will perform an autoimmune panel or a rheumatological panel
Okay.
and look for these autoimmune inflammatory markers.
Okay.
So rheumatoid factor, some elevated ESR, CRP, these are all inflammatory chemicals that we can measure in a blood test.
Okay. And then you had mentioned with the osteoarthritis that a lot of athletes are experiencing this. What about people, let's just say you have, a woman or a man who is at the computer a lot, doing a lot of work with their hands, whether they're, a plumber, construction worker. Can those types of occupations cause arthritis as well?
Absolutely.
Like in the hands and joints?
For sure.
Okay.
Yeah. So anything where you're doing repetitive motion,
Okay.
that can cause a wear and tear of the cartilage,
Okay.
which can lead to osteoarthritis.
Okay.
And sometimes it just happens over time. Just
Okay.
by living on planet, I tell patients, look, if you lived in outer space, this may not be an issue.
Yeah.
But because you live on planet Earth, you have gravity acting on you, right? So it's
Okay.
compressing your body. So
Very
that's why
interesting.
movement is so important. But it's doing healthy movement, right?
Mm-hmm.
Jarring sports, things like that, repetitive motions can
Mm-hmm.
over time lead to wear and tear of that cartilage and lead to osteoarthritis.
So then this goes into treatment. So as we're sitting here talking, my wheels are turning and I'm thinking, so does this mean, when you wake up in the morning, it's a good idea to kind of stretch your joints and kind of, get everything moving and, ready for the day? Would that, by doing that, is that going to help prevent osteoarthritis?
Well, I think it's a kind of a challenging thing to prevent osteoarthritis. I think it's
Okay.
going to affect us all eventually, but there are things you can do to reduce the onset and severity.
Okay.
Stretching is one of those things for
Okay.
sure, but I'm a big fan of physical therapy and physical
Yeah, of
movement.
course.
So really strengthening the muscles around the joint. I mean, the
Okay.
joint is made up of tendons and ligaments and all the muscles that attach through the tendons around the joint. So by stabilizing and strengthening those muscles, it can actually take pressure off the joints and have the joints function more optimally, if you will.
Okay.
And that can take pressure off the cartilage and reduce the risk of osteoarthritis.
And when it comes to movement, you and I have had this conversation about running and, kind of hard impact type activity. Would that affect the onset of osteoarthritis?
Absolutely. I have
Okay.
a handful of runners I take care of, and usually hips and knees are the most common areas we'll see in our runners
Okay.
that have osteoarthritis. But, I tell people, I want you to live your passion.
Right,
So
of
the goal
course.
is helping you manage the discomfort in the healthiest way possible so you can keep on living and doing the things you enjoy to do,
Okay.
you enjoy doing.
Yeah, of course.
mhm.
Yeah, it makes sense. And what about getting in a pool and kind of doing exercises in the pool?
Yeah, typically
Yeah.
for arthritic pain, pool exercises are some of the best you can do.
Okay.
Because there's a buoyancy effect, so it takes pressure off the joints. And I always tell patients who are not typically active people, just even get in a pool and walk back and forth. The buoyancy will take pressure off your knee joints, your hip joints, your feet and ankles, and then walking back and forth is a resistance as well, so you get slight resistance training.
Yeah.
So, and that's something easy to do, especially in Arizona. You
Yeah.
know, we pretty much have swimming weather all year round.
I mean,
so.
I've been doing it for a while now. I've been getting into the pool, and I do notice a difference as far as how I feel when I'm exercising. The exercises don't seem as hard, and I don't feel like I'm as sore the next day, but still feel like I'm actually getting some form of movement on my joints. So that's great. Now, as far as treatment goes, so if somebody comes into you, you diagnose them with osteoarthritis or rheumatoid, how are you able to treat those patients?
So typically physical therapy, some
Okay.
type of anti-inflammatory, whether it's an over-the-counter medication or a prescription anti-inflammatory, ibuprofen, Aleve. I always tell patients to use caution with those kinds of medications because long-term use can cause kidney issues,
Gut issues.
bleeding in the gut,
Yeah.
exactly, increase your risk of cardiovascular disease, heart attack, stroke, all those bad things can happen with regular use of NSAIDs, non-steroidal anti-inflammatory drugs. I'm a big fan of physical therapy. I think
Yeah.
that's really important for anyone with osteoarthritis or even rheumatological arthritis.
Okay.
Most of what I see though is osteoarthritis. The rheumatological conditions are usually managed by rheumatology.
Okay.
I'll perform adjunctive modalities that may help with this, such as low-dose naltrexone.
Oh,
That's a
yeah.
medication that's got a lot of buzz in the community and
And that helps with inflammation in the
helps with
body?
it can
Reduces it?
potentially reduce
Okay.
inflammation, yeah, and actually have some positive effects on the immune system to balance the autoimmunity versus your normal immunity.
Okay.
So, we do joint injections, corticosteroids. I try to limit the amount of steroids we put in joints because steroids will, although they can be very effective in reducing inflammation, they will actually, they're toxic to the cartilage.
Okay.
So they can accelerate the cartilage death.
Oh.
So, which in turn accelerates osteoarthritis.
Okay.
So,
So you're very mindful about what treatments you're performing on your patients, which is great.
I am very mindful about
Yeah.
that, but unfortunately, a lot of the things that are not covered by insurance
Yeah.
are cash pay, of course,
Yeah.
and they're actually better for people. But many people that I see are limited to whatever their insurance will cover, and
Okay.
steroids are generally covered.
Okay.
But I'm mindful of the amount that we use and how
Yeah.
often we're doing them. PRP is another option.
Yeah.
So there's some anti-inflammatory properties of platelet-rich plasma, which is, where we take your own blood, spin it in a centrifuge, and concentrate growth factors and anti-inflammatory factors as well as platelets. Hyaluronic acid. So these are gel injections that
Okay.
we do into people's joints. Currently, I'm doing them for the knees. And this is a great alternative to steroids because it doesn't destroy the joint tissue. If anything,
Okay.
it helps preserve the joint tissue. And it's just a concentrated form of the natural lubricant we form in our knees and our joints.
Does it act as like a cushion
It's
that's
more-
in the knee?
You can think of it like that,
Okay.
but it's more of a lubrication.
A lubrication.
Yeah.
Okay.
So it just replaces the joint fluid that's lost over
Okay.
time.
Got it.
And that can provide 6 months to a year of relief in some patients.
So when it comes to rheumatoid arthritis, does diet play a role into the severity of your symptoms?
It can definitely influence the
Okay.
severity of symptoms. So ideally, we're big fans of the anti-inflammatory
course.
diet,
Yeah.
avoiding processed sugars, refined sugars, and processed foods and
Yeah.
chemicals.
Yeah.
So all those things are pro-inflammatory and will create a heightened inflammatory state throughout your body that's not healthy. There's good inflammation and there's bad inflammation. So,
Okay.
I really feel that people can reduce their risk of inflammatory disease by monitoring what they eat and pay attention to the ingredients they're putting inside their body.
Absolutely. Yeah. Wow. Fascinating. I feel like I've received a whole education about the differences between osteoarthritis and rheumatoid arthritis. For me, I've known about arthritis, but never really knew the difference. So it's been great.
Yeah, we've never had that conversation.
I know we really
Yeah.
haven't. Yeah. It's very interesting. So thank you, Dr. Goyle, for
thank you.
giving us that very thorough explanation of what osteoarthritis and rheumatoid arthritis are. If you have any questions about the topic that Dr. Goyle and I spoke about today, you can always reach out to us either on Instagram, Dr. Ashu Goyle, or you can also reach out to us on our website, which is www.ispwscottsdale.com. Stay tuned for further episodes with Dr. Goyle and myself. Thank you.
Great, thank you.